It's not just a trade war, it's a war on health. We all want our communities to be safe and healthy, but every day, families across Mexico, the US, and Canada are losing loved ones to unregulated drugs.
President Trump is manipulating genuine community concerns to impose expensive tariffs on Mexico and Canada, leading to a trade war worth trillions of dollars. The result? Rising food prices, families torn apart, and escalating conflict and fear.
If our collective well-being is truly the goal, why are our governments cutting funding to life-saving, health, addiction, and overdose prevention services? Why are they fueling conflict instead of saving lives? Since December 2024, the Canadian government announced $1.5 billion on wasteful and ineffective technology for so-called border security, double what the federal government spent over 5 years on the National Drug Strategy, which included law enforcement, prevention, treatment, and harm reduction initiatives.
In Mexico, after more than 15 years of militarizing our way out of the drug problem, homicidal violence has worsened, human rights violations have increased, and in general, a new crisis of disappearances, weak civilian institutions, and a deformed function of public security has been created, thus delaying necessary reforms to improve our security and justice system.
In the US, the Trump administration is pushing $2 trillion in federal funding cuts that would gut life-saving health, treatment, and overdose prevention services, just to fund more money into enforcement, among other things. These policy decisions will devastate our communities, fueling more deaths of our loved ones, limiting access to treatment and care, and escalating violence from cartels to meet demand.
Real safety means investing in our people, reducing demands for drugs by addressing why people use them in the first place, and investing in what people need: housing, jobs, voluntary treatment, overdose prevention, and healthcare.
No more trade war, no more violence. Our leaders must choose a health-first, demand reduction approach that helps people and saves lives.
Please stop trading our lives away.